Hi, I'm Liz O'Riordan. I'm a consultant breast surgeon and I'm going to show you how to examine your breasts properly. The first thing you're going to do is look. You're going to get topless in front of the mirror and look at yourself. If you've got heavy breasts, lift them up so you can see underneath. Then turn to the side and the other. You're looking for lumps that you can see sticking through the surface of the skin. You're looking to see whether the nipple has been pulled in. And you're looking to see if there's a little puckering of the skin, and it might be really subtle, and that's because breast cancers grow and they cling on to strands of tissue that go from the chest wall at the back through to the skin, and as they grow they constrict those strands of tissue, and that's what causes a dimpling that you might see. The next thing you do is put your hands above your head, and then you put your hands on your hips and push in, tensing the chest muscles. And doing both of those things can show you a lump or a tethering that you wouldn't otherwise see. Hi, the next step in checking your breasts is to feel. What most people don't realise is the best way to examine your breasts isn't standing up, unless you have very small breasts. But really, you should do it how a breast surgeon does it, and that's with you lying flat at about 30 degrees. For example, lying down in bed with your head propped up on a couple of pillows. What that does is lift a heavy breast onto the chest wall. And if you've got particularly large breasts that like to flop over to the side, you can roll your body towards the midline. And what that does is lift your breast tissue onto the chest wall, making it much easier to feel if there's anything there. So how do you feel your breasts? Well, the most important thing is to know which part of your hand to use. And it's the undersurface of your fingers. Keeping your fingers flat, you bend them at the knuckles, and what you're trying to do is to squish your breast tissue against your rib cage underneath, like this, by pushing down, seeing if you can feel a lump. A lot of women, especially around the time of the month, can have very lumpy breasts. It can feel like a mixture of sweet corn and jelly, and it's completely normal. Often this bit of the breast is the most lumpiest bit, and if it does feel lumpy, check the other side. They're probably the same. If there is a lump there, for example, my lollipop, you can squish this breast tissue all the way down to the chest wall, and the same on the other side. But if there is a lump there, you'll feel it. You won't be able to push down as flat. And that's the lump that you probably need to let your GP know to get it checked out. So you're going to examine your breasts. Think of your breast like a teardrop that does that. It doesn't matter how you do it. I tend to start in circles, going around the outside, moving in until I get to the nipple. When I get to the nipple, and I'm pressing quite firmly here, I feel behind the nipple as well. The final place to look is underneath your armpit, because you can get enlarged lymph nodes there. If you're slim, you may feel them normally, and they're about the size of a split pea or a lentil. Cancerous lymph nodes are bigger and firmer, maybe like a marble or a boiled sweet. The trick is to relax your armpit, so rest your hand on your shoulder. With this hand, what you're trying to do is squish the tissue and the fat of your armpit against your rib cage. So my hand's nice and relaxed, my arm's going in really high above the hairline, and I'm just kind of squishing up there to see, can I feel any hard lumps underneath my fingers? And then do the other side.